Good morning, everybody. Travis Kern here from Root and Branch Chinese Medicine in Portland, Oregon. On my way into the shop as usual on an unusually very sunny winter day here in Portland. So you guys will have the pleasure of seeing the sun like glare into my eyes. There you go, just like that. Anyhow, today I wanted to talk to you guys a little bit about Chinese medicine's history and sort of how we got from a medicine that's many thousands of years old into what we deal with today. At my meeting, one of the other members who works in air conditioning and heating actually was talking about the evolution of tech involved in heating homes. And it just got me thinking about the idea of evolution and the idea of change over time, you know. One of the things that you'll hear if you read anybody's website who does Chinese medicine or go to a talk about Chinese medicine or pretty much anything at all that deals with Chinese medicine, you'll probably hear something like, Chinese medicine is over 2,500 years old. Acupuncture has been practiced for thousands of years. The medicine has roots in Taoist ideas that are many, many thousands of years old. You'll hear various numbers, more than 2,000, more than 3,000, more than 5,000. All of those numbers are kind of erroneous, by the way. Like, why 2,000 versus 5,000? I mean, it depends on what you're counting and how much evidence we actually have for a year point. And also, you know, what you mean by Chinese medicine, truly. Because what we mean by Chinese medicine today is a specific set of circumstances. It's acupuncture needles, single-use sterile acupuncture needles. It's herbal formulations from bulk herbs, bulk whole plant herbs, or granule tea powders, maybe pills, cupping therapy, heat therapy, some types of Chinese massage. All of that falls under the banner of Chinese medicine. And when we go to school to learn about Chinese medicine, we learn all of those things here in the West. I mean, school programs are mandated to have, you know, some combination of all of those things. So that idea, modern Chinese medicine as it exists, as a single curriculum taught to individual people in the West who do both acupuncture and herbs and cupping and heat therapy, that's not 3,000 years old. It's just not. In fact, it's a creation of the post-Mao communist period in China and the exportation of it to the West. Now, don't misunderstand me. I don't mean to say that that doesn't make it valuable. I'm just putting a time frame on it. What is important to understand, though, is that the basis of Chinese medicine, the theoretical framework upon which modern Chinese medicine education is based and modern Chinese medicine practice is based, that theoretical framework does in fact go back thousands of years. Its origin point, though, you know, it didn't exist in the form that it exists now 3,000 years ago. It's been in evolution. And, you know, saying that something is old in and of itself is perhaps not a very good reason for doing it, right? Like, oh yeah, that's what we did 3,000 years ago, we should keep doing it. Except to say that human beings generally don't keep doing things that we've been doing for thousands of years if they didn't have some kind of value. Humans tend to be pretty efficient creatures in that regard. Like, we tend to say, nah, we've been doing that long enough. We don't want to deal with that now. We're gonna stop it. Chinese medicine didn't suffer from that problem. I mean, we've literally been doing it in some form or another since its inception. So that, I think that is significant. That it's old isn't necessarily what matters, but that we keep using it over and over again does, I think, hold some weight. However, the significant thing about Chinese medicine's age, and the thing that you don't often hear a lot of people talk about, is that Chinese medicine has been under peer review for the entirety of its history, right? So let that sink in for a second. From at least 2,000 years, if not longer than that, because we have texts, actual physical texts that we can date from that period. But for at least 2,000 years, a method of diagnosis and treatment has been practiced in the field on real humans. And practitioners of that medicine have written about their use of it. Saw this patient with this condition, case studies basically, right, where you have all of these details put together. And then other practitioners have read those case studies and commented on them and said, I think you're full of it, I think you should have done this, that doesn't really work. You've read about this, but in my practice, it's more like this. Or this guy was on top of it. He cured all of these people. I've seen it. It worked really well. He made this adjustment. I think that's valuable for this kind of person in this condition. And I don't mean just one text of commentary. I mean hundreds of texts of commentary, right? Some of them very famous, some of them less famous, some of them in whole form that survived to the modern period, some of them partial. And certainly in the last 100 years, the amount of commentary that we have developed on Chinese medicine practices is massive. And so a lot of people out there, you know, biomedicine folks, rational Western-minded folks who are like, there's no evidence that acupuncture works, there's no evidence that Chinese medicine works, it doesn't perform well in a double-blind randomized control study. You're talking about something that you're assessing acupuncture and Chinese medicine using a lens that I don't think is very valuable, and we can talk about that in a minute. But there is no dispute over the fact that learned users of the medicine have been using and commenting on the medicine for thousands of years, honing the craft, right? Like in practice, on patients, real people honing the craft, such that the inheritance of that process today in the 21st century means that what I learn and implement and comment upon with other of my colleagues and contemporaries is a refined version of medicine. A clearly tested, clinically proven version of health and healing, okay? It's not some esoteric, just, you know, new age belch of information, like, oh, I feel the energies moving through the person. Like, you can heal people that way, right? I don't heal people that way, but some people do heal people that way. Fine. But that's not what Chinese medicine is, right? Chinese medicine is not some arbitrary, feelings-based system of medicine, right? It's a diagnostic system rooted in core philosophies of natural observation that have been observed, commented upon, corrected, honed, and refined over literally 2,000 plus years, okay? There are not many things that we can say that have been consistently worked upon and developed, refined and organized in the same way that Chinese medicine has over the same period of time, okay? Certainly not biomedicine, right? We can't say that we've done, you know, 1,000 years of commentary on knee replacements and how good they are or aren't, right? Because that's just the reality, and that's just the age of the medicine. I mean, biomedicine hasn't been around long enough in order for people to do that. But to suggest that because acupuncture doesn't perform better than placebo in a randomized controlled trial misses the point entirely. Have you ever asked yourself, are there randomized controlled trials for liver replacements? Or hip replacements? Or open heart surgery? Think about that for a minute. A randomized controlled trial, placebo-controlled trial, is something that we use to test pharmaceuticals. We have an idea, we create a drug, we create groups of people, we have the test group and the control group. The test group is going to get the drugs, the control group is not going to get the drugs. They're not going to know who gets what. In a really rigorous study, we'll call it a double-blind study, even the people administering the pills don't know who's getting what. Only the researchers on the other end who have coded the data will know, so that way we're trying to eliminate bias. This is how we test pharmaceutical drugs. And the question of placebo is a whole complicated thing in and of itself, but it might be an effective way, in fact it has proven a relatively effective way to test pharmaceuticals, because we're testing one thing against another thing compared to nothing, and the drug maker wants to know if all these chemicals that they're giving someone actually do more than a sugar pill given to someone. And if they do, and again, like how regulated this is a questionable matter, but if they do perform better, then they become a drug, etc. The thing is that some people in that study know that they're not getting the drug. They signed up for it, they knew about it ahead of time, and generally in these kinds of studies, we're not like trying to control for something that is like immediately life-threatening. But imagine if we really wanted to test whether or not open heart surgery, coronary artery surgery was as effective as other modes of intervention. What we would have to do is cut open some people's chests and fix their arteries, and then cut open other people's chests and not fix their arteries, but tell them that we did, right? That would be the standard placebo trial, blind. The patients wouldn't know who got what. And that poses obvious ethical and moral quandaries, okay? Similar to knee surgery, which may not be as life-threatening as, say, coronary artery, repair and maintenance. But you are going to put someone under anesthesia, which, puts them within, a hair's breadth of their own death by just being, brought under so that they don't feel any pain. You're going to cut open their knee and cause all kinds of surgery-based trauma and damage, and then not actually replace it? Ethical problems. So thankfully, don't get me wrong here, thankfully we don't run randomized controlled double-blind studies, placebo-based studies on things like surgeries, right? That's a good thing, probably, from an ethical point of view. However, acupuncture is like a surgery in that it is a procedural process. It's not a drug, right? How can you possibly do not acupuncture while someone thinks they're getting acupuncture? Like, they invented these little, they're called sham needles, and they're like a tube that the needle is in, or a fake needle, and it's like one of those theater knives, the stabby knives. You can stab yourself with it, but the blade, goes back inside. It's actually a great example. If you go to like party store and buy one of those little fake stabby knives and stab yourself with it and ask yourself, did you feel, you didn't get stabbed obviously, but did you feel the knife point pressing on you? Yes, of course you did, right? So there's no way for you to introduce a stabby knife thing, a sham needle, that doesn't stimulate the area. So there's no way to actually create fake acupuncture, right? A sham acupuncture. It's like I guess a reasonable approximation, but it's not, right? Because you're actually still stimulating the area. So the design of the trial is already dumb. And you're trying to test a procedure using a method designed to test a pharmaceutical intervention. And so the whole thing is backwards. Instead of relying on the fact that we have been testing, commenting, and adjusting this material for thousands of years, recorded in texts that are available and translated into many, many languages, instead of that, relying on that and using that to justify the effectiveness of the medicine, we try to create these studies that in no way, shape, or form reflect the actual usage of the medicine itself. Evolution in thinking is a process. It's something that many of us engage in all the time. It's extremely important to the development of any philosophy, science, activity, standard operating procedure. All of it is essential components. And yet, right, modern society hasn't given the necessary weight to the reality of clinical trials over thousands of years that have been done with Chinese medicine. So when you're asking yourself, do I want to try Chinese medicine? Is this for real? Do I believe in it? Let me clarify. You don't need to believe. Like, Chinese medicine doesn't require your belief. It's not a faith-based system. It's a scientific system, right? Where science is this idea that we observe things, comment upon them, make hypotheses, assess those hypotheses, judge them over time. That is Chinese medicine. It is science, okay? It uses a different framework. Not a magic framework, not an emotional framework. Oh, I feel that this is working, I believe in it, right? It's a science, and it's a system that functions in that same exact way. So if you want to try Chinese medicine, you should give it a try, and understand that if you find a well-trained and educated licensed practitioner, that you are getting access to a system of medicine that is thousands of years old, tested over thousands of years, and continues to be tested and checked upon in a modern setting. Right? This is your opportunity to have access to a way of thinking about health that's different than what you're used to, and could very well provide you with solutions and treatments for things that you may not have even thought were treatable. All right? So there you go. That's the rant. That's the intensity about it. We're going to talk about this more and more because it's near and dear to my heart. But that's your intro into the evolution and process of how Chinese medicine works. Check us out at www.rootandbranchpdx.com. We have all kinds of information about this and other materials, information about the clinic, information about how you can get herbs from us, see us in treatment if you're in Portland. Again, Travis Kern for Chinese Medicine, Root and Branch Chinese Medicine in Multnomah Village, www.rootandbranchpdx.com. Have a good one.